All right. Hi, everyone. Welcome to AMCHP's April National MCH Policy Call / COVID-19 Town Hall. And Olivia, can you advance the slide? Thank you. As usual, we will be in listening only mode, but we'll be able to unmute during the Q&A. If you have any technical difficulties, please email Jess Cohen, jcohen@amchip.org. And if you do, also wish her a happy birthday because today's her birthday. So our agenda is going to be a little bit different than normal. We're going to let Dr. Warren from MCHB go first because he has a time conflict. And then he's also going to tee up one of our guests for today, who is from the Tennessee Immunization Program, followed by an AMCHP policy update, a CDC update, and another special guest from the North Carolina Department of Health and Human Services, Office of Minority Health and Health Disparities. So with that, I will turn it over to Dr. Warren.
Thank you so much, Amy. Good to join you all and appreciate you letting us go quickly at the beginning. Just want to share a few updates. Next slide. As you all know, the TVIS season has begun. And when the slide advances, you will see the work that's going on. Yep. So the due date for the block grant is September 1st. Again, this year we've extended the deadline for that, recognizing that you all are in the middle of the COVID response still. And so we have extended that from the typical July 15th date to September 1st. There have been trainings this week for folks who are new to TVIS or for those who needed an update. And we'll start the learning labs later in April. Those are always typically well received and give folks some support as they're refreshing what it's like to use TVIS and move forward in submitting their block grant report and application. Those will be recorded, both the learning labs and the training. So if you're not able to join, you'll be able to still see those. Next slide, please. Another quick announcement, just wanted to make sure folks are aware the special enrollment period that we've told you about before has been extended. So originally that was going to be through May. That's now been pushed to August 15th. So again, this is an opportunity for connecting with families and families with children who may be eligible and connecting them with the marketplace to help them connect with sources of insurance coverage. So on the healthcare.gov site is where they will access that. CMS has materials that you can use to help promote this, messages you can use and things like that. So encourage you to think about insurance coverage status for kids in your state and where there may be some opportunities for your Title V and SHIN programs to do some outreach and make sure that we can get as many families who are enrolled as possible. As you all know, over the last 4 years, there was a sharp decline in the number of children who were enrolled, leading to about 4 million children currently who are uninsured in this country. So there's a great opportunity to take advantage of this special enrollment period. Next slide, please. Wanted to spend a little bit of time today talking about immunizations. We've talked a lot about immunizations over the last year. It turns out, as we think about the MCH implications of COVID, one of those is the decline that we've seen in routine pediatric care, and that includes both well visits and immunizations. So our partners at CDC recently released a call to action, encouraging folks to think now about back to school immunizations. So if you look at the last year compared to 2019, there's been a big dip in vaccine ordering for publicly insured vaccines. This is like VFC. So a 14% decline overall. And if you look at measles containing doses, it's about a 20% decline. So cumulatively, there's a large deficit in the amount of vaccines, particularly measles containing vaccine that has been given over the last year. And that really sets us up for some bad consequences. We don't want measles outbreaks occurring on top of the already stretched thin public health and healthcare systems that are responding to the COVID pandemic. So the answer to that is to figure out how to get kids and families back in and get them vaccinated now. The other thing that's coming up is as we head toward the late summer and fall, we anticipate there being available based on things that have been shared to date. We anticipate that COVID vaccines will be available for adolescents. That's also going to be typically the time they do back to school vaccines and get those vaccines for Tdap and meningitis and HPV. And right now you can't give COVID vaccine with other vaccines. And so the concern is that families may choose to get the COVID vaccine, which is understandable, and not get those routine adolescent immunizations. And we all know how important those are. And you all have done so much work over the last few years, particularly around HPV. So again, the message is get them in now. Don't wait till back to school time, because for those adolescents, we'll want to be engaging them around COVID vaccine. So we want you all to think about ways that you can partner with healthcare systems, providers, schools, states, local governments, and families to do this encouragement of those routine immunizations now and not wait until back to school time. And as you all know, thinking about gap filling services to increase rates of pediatric immunizations is really one of the core roles of Title V, and something that's actually mandated in our statute. Next slide. This next series of slides actually is just going to walk you through to show examples of where states are already thinking about this. So the states that are shown in blue have selected National Performance Measure 11 around medical home. One of the tenets of medical home is that we have this comprehensive care and connecting families to those supports and services. So for these states, if your state is shaded, you may already have efforts underway really thinking about bolstering medical home efforts. And for the states with the little yellow star, those have actually stated this as a priority for kids both with and without special health care needs. So 39 states across the country already really primed to be able to move forward with this. Next slide. The next few slides walk us through a number of the national outcome and performance measures that show how well we're doing overall. This slide shows the 7 vaccine series. These are for the younger kids, so vaccination by the second year of life. And these always lag a few years behind because they look at a birth cohort, but about 70% of kids who are vaccinated by age 24 months. With those expected vaccines. And you can see the performance varies across the country. Improvement seen in a few states where you see those green arrows, but a lot of opportunity to think about how we get kids in for routine immunizations. We know that there are disparities. If you look at children of color, if you look at children who are publicly insured, children whose families have lower income, all of those children have lower rates of vaccination compared to the rest of the population. So this is the series of vaccination for younger children. Next slide, please. We'll talk about some of the adolescent vaccines. So I mentioned earlier HPV vaccine nationally. We're over 70%. You can see the states with the green arrows that are showing improvement. One thing that's interesting, we also have a number of states that have the check marks here that have adolescent well visit as a national performance measure. So again, Title V programs in many of these states are already well poised to be thinking about this. In many cases, you've already got those partnerships, you've already got activities that are working toward this. So a great opportunity to build on those and encourage those routine vaccinations now. Next slide, please. We see similar efforts around the Tdap vaccine. And so you'll see the states with the green arrows where there's been improvement. Again, the states that are marked that have adolescent well visits rather as a national performance measure. And then the last slide with data, next slide please, yep, is for the meningitis vaccine. Again, you see the states where there are already activities around adolescent well visits, a few states that have shown improvement over the last few years. And as with all of these, variability in performance across the country and marked disparities. If you look at the vaccination rates across states, again, as with other vaccines, lower rates for children of color, kids who are uninsured, and for the meningococcal vaccine for kids who live in rural areas. So we wanted to share that with you, one, to make sure you were aware of the call to action that CDC has recently published. Just before this meeting started, we sent out on the Title V listserv An email from our colleagues at CDC announcing a webinar they're doing next week on April the 7th. So I encourage you to look at that. It's a partner webinar. They're going to be talking along with the American Academy of Pediatrics about the call to action and this need to get kids in for vaccines now. Next slide, please. You all have heard us talk about the challenge, the P4 challenge, promoting pediatric primary prevention. Wanted to give you an update. The deadline for submissions was March 15th. And again, we launched this last year when we first started hearing about the declines in well visits and immunizations. The response just blew us away. We had 241 applications that came in, and just for frame of reference, we typically get about 70 applications for these challenges. The applications came from all over the country, 193 cities, 44 states, and 2 from Puerto Rico. And you'll see on the next slide a map that shows the states. Oh, sorry, I got ahead of myself. You will see a map. There we go. So you see a map with those numbers. These are the numbers of applications that were submitted by states. And you can see that we got applications from many of the states, most of the states actually. Some of you were rock stars, whatever you all did in California to promote this, and New York, you did a great job. Texas as well with high numbers, Florida, Illinois. You're testing my geography to make sure I can see these, pick out the state names by their shapes. But you all did a really fantastic job of promoting this. And we know that Title V agencies were engaged with community partners, with their state immunization programs, with healthcare providers and professional associations. So what we will do now, I think it's on the next slide. If we can advance one. Actually, sorry, go back to, I got us out of order. Go back to the slide, yep. There we go. So we will pick 50 winners in phase 1. The total prize purse for this challenge is $1 million. Half of that goes to phase 1. So those 50 winners will get $10,000 each. Those 50 winners will then implement their plans for improving well visits and immunizations and partnering with community partners. Again, the ask was to partner this with pediatric primary care medical homes. So we don't want to disrupt the primacy of the medical home. We want to really reinforce that, but we also know we have to do things differently and think about how we increase well visits and immunizations. So those 50 folks will implement their activities. We'll give them 6 months. They'll report on their performance. And from that, we'll pick 20 winners to share a $500,000 prize purse. So they'll get about $25,000 each. So if we can go forward 2 slides, I'm going to introduce one of our state colleagues. So Dr. Michelle Fiscus is the director of the State Immunization Program in Tennessee. She's a pediatrician, a board member for the AAP, a longtime friend of mine and mentor to me when I was a resident and fellow and young pediatrician. And so I was recently talking with Shelley about another issue, and she was telling me about an amazing event the team in Tennessee had helped to put together. And I told her the danger of sharing those stories is then you get asked to share them more broadly. We always like to highlight bright spots. So really appreciate the opportunity for Dr. Fiscus to join us and talk about the great work they've been doing in Tennessee to try to bridge this gap. And one quick thing before I turn it over to Dr. Fiscus, our colleague at CDC, Wendy Rubin, shared the link to the webinar for you all. So again, please take advantage of that and join that link and share that with your partners. And with that, I'll turn it to Dr. Fiscus.
All right, great. Thanks, Dr. Warren. It's good to be with all of you this afternoon and to brag a little bit on some of the things that we're doing in Tennessee. So if you want to go to the first slide. As Dr. Warren was mentioning, you know, the decline in routine childhood immunizations is really startling. And when you look at this slide of Tennessee data, all the way back in February, we were beginning to see some decline in immunizations in February 2020 compared to 2019, even though we didn't get our first case of COVID-19 identified in the state until March the 5th. So we were already seeing a month of hesitancy amongst parents in bringing children in for well visits and getting those routine vaccinations. And then we really hit our nadir in April of 2020 and have not been able to catch up these kids over the course of the last year. In fact, in January and February of 2021, our numbers are actually worse than they were in 2019 and 2020, January and February. So we're very concerned about the loss of routine vaccinations amongst children. And as Dr. Warren mentioned, with COVID-19 vaccines coming for adolescents, hopefully sooner rather than later, there's going to be a blackout period where we're going to have trouble getting kids caught up because they're going to choose to get vaccinated against COVID-19. If you go to the next. So one of the innovative things that we've done in Tennessee is to partner with our local diaper bank, Nashville Diaper Connection. And what they have been able to do is set up events using our federally qualified health center partners in generally in the Nashville area to hold socially distanced drive-through childhood immunization events. But these are incentivized so that parents that bring their children in to get them caught up for vaccines are given diapers. And then in many situations, they've also partnered with the Second Harvest Food Bank to give food bags to these families as well. And so they have held a number of these events across the state over the course of the last year, just trying to find ways to get children immunized in a time of COVID when they might be hesitant to go into their provider's office, and also when health department capacity to deliver primary immunizations is down because they're all busy with testing and immunizing against COVID-19. This is one opportunity to provide that service and also provide some other things that families need. If you could go to the next, please. So they have held 19 different events across the mid-state over the course of the last year. We initially engaged them to help provide childhood immunizations, but then in the fall, we moved into asking them to provide flu vaccines as well. And then we are funding them going forward to also be able to provide COVID-19 vaccines so that when children are coming to get their catch-up vaccines, we can get parents and caregivers immunized against COVID-19 at the same time. Next, please. One of their most recent events was actually held on Halloween, and so there were bumblebees and butterflies and all kinds of fun people running around on these lines administering vaccinations. Diaper Connection also partners with our MCOs. So at the same time that families are there getting immunizations, getting diapers, getting food bags, they are also getting resources to sign up for the state's Medicaid programs and getting information about those resources as well. So they have a good bit of time to sit in the car and wait between registering and then waiting after they get vaccinated. And so it's a good time to provide some educational resources as well. Next, please. So in just 9 months of last year, they were able to give diapers out, 144,000 diapers to almost 6,000 babies across the middle part of Tennessee. They had 19 vaccination events, and through those vaccination events administered 1,058 immunizations that might otherwise have gone unadministered had it not been for their program. So they've just been a tremendous partner. I know a lot of cities have diaper banks, and this might be an opportunity for you to partner to get children caught up, especially children who are in underrepresented populations that may have a harder time accessing care. There is a lot of money coming into immunization programs because of COVID-19, and it's also a great way to support this kind of work that they're doing alongside the FQHCs. So that's what I have to share with you. If you go to the next slide, my email address is there, michelle.fiskus@tn.gov. If you'd like any other information, I'm happy to answer your emails. Thank you.
Thank you so much, and some really cool stuff you guys are doing in Tennessee. I'm gonna keep moving along. We have a full agenda today, but as always, if you have any questions for any of our presenters who have gone so far, please feel free to type it in the chat at any time, and we'll make time available at the end as well. So I wanted to give a quick update, excuse me, on COVID relief. The last time we spoke was just before the bill had been signed into law. I think it had just been introduced. So to give you a recap, the American Rescue Plan Act of 2021 is now signed into law, and there's a really great resource from the National Conference of State Legislatures. So I put that here as well for you to read up on specific state funding provisions that are coming out of it. But the top takeaways for maternal and child health, I think, are really around the postpartum Medicaid extension option that's going to be available to states now, as well as the additional funding for MCHB, $150 million in supplemental funding for MCHB through the end of FY22. And there are some other really great provisions related to public health, workforce, COVID response support, but even more general public health support. I did want to mention that actually right before our last call on March 3rd, there was a great briefing that we had the pleasure of co-hosting with Parents as Teachers National Center, where we talked a lot about home visiting and how it's also been having to adapt during COVID-19, and wanted to give a special shout out to Marcus Johnson Miller from the Iowa Department of Public Health, also an AMCHP board member, for his participation in that. It's recorded, and I think it went really well. We were joined by Senator Mike Crapo of Idaho during that as well. And the audience was mostly, congressional staff, as well as home visiting folks in the field. It's still FY22 appropriation season. As we mentioned, the ask that AMCHP has been using this year is $750 million for the Title V block grant in FY22. Strange year because it's a presidential transition year, which means the president's budget is delayed. So we had to start, making our ask before we actually saw what the president put in his administration's proposed budget. We hear that the skinny budget, which is like an abridged version, may come out this week. So we'll be looking for that, but the full details of the president's request probably won't be available at least until sometime in May, which means the appropriations committees on one hand have later deadlines than usual, because I guess they realize they still need to see the president's proposal before they make final decisions. But at the same time, it does sort of drag out the process as well. But one of the really nice things that we were able to participate in as well was that last week, the Subcommittee on Labor, Health, and Human Services, which is part of the House Appropriations Committee, held a hearing about addressing the maternal health crisis. And we were so pleased to have Lisa Sare from the New Jersey Department of Health, also an AMCHP board member, as one of the witnesses. She did a phenomenal job really highlighting some of the innovative work they're doing in New Jersey. You can go check out the recording and the testimonies at the link. It will be included in the slides we mail out after the call. But it was a really, really great bipartisan discussion. I think we spent a lot of time watching, the news and the pundits talk about how partisan the climate is in Washington right now. But I really must say this subcommittee hearing was so bipartisan, and such a great commitment from folks on both sides of the aisle to really investing more to address maternal health. And of course, investing in maternal health is also investing in children's health. And so I really encourage you to check it out if you have some time. I know, none of you are busy or anything, but it was a really great opportunity to highlight the issues that we work on so closely day in and day out, and really great discussion on how we work together to address health disparities and really recognizing the root cause that is racism for so many of the disparities that exist. So we're also really pleased that we have a nice bipartisan effort to collect members of Congress to, sign a letter of support for increased appropriations for several maternal health programs that we all care about. So that's the Title V block grant, Healthy Start. Those are both in HRSA, of course. There's the Safe Motherhood and Infant Health portfolio at CDC, and the National Institute of Child Health and Human Development, or NICHD, at NIH, which really focuses on maternal and child health research. So we have, again, a great bipartisan group of members of Congress who are leading this effort, and we're hopeful that they will be able to be a show of force as well. Another appropriations request that AMCHP is helping to lead is around increased funding for the Surveillance for Emerging Threats to Mothers and Babies Network. And so we're asking for $100 million so that we can expand this program to all states and territories. We know that the states that have received this funding in the past are already adapting it to respond to COVID-19, and that's exactly what this program is set up to do. But it can't be as effective if we aren't able to run it in every state. So that's what we're hoping to get support for with this request. So next, I will turn it over to Stacey Collins from our Health Systems Transformation team.
Thanks, Amy. Hi, everyone. Good morning or good afternoon, depending on where you are. I'm just going to take a couple of minutes to talk about some resources that we've developed here at AMCHP that we hope you'll find helpful in your work. As Dr. Warren just mentioned, I don't know why I have this on the left-hand column here. I don't know if someone could take that off. Not sure if anyone is seeing that, but anyway, we have produced some material for the new special enrollment period. And as Dr. Warren just said, it has been extended by the Biden administration. And this is out of concern that all Americans have comprehensive coverage during COVID-19. So the special enrollment period has now been extended another 3 months through August 15th. These material might look familiar to you. We had developed them with the last date. They've now all been updated, so we really encourage you to use them. The document on the left is a fact sheet that describes the SEP and how MCH Title V programs can promote it within their states. And then the other two documents are the parent fact sheets in Spanish and English. So as Dr. Warren said, please do everything you can to get the word out. Please use the resources, disseminate them as widely as you can, because it really is critically important during the COVID crises. And these are all available on our website, and I think you'll be getting links to them later as well. Next slide. Here's another resource that we developed, which is looking at Medicaid policy options for states during COVID-19. It's an examination of options such as waivers and state plan amendments that states can use to meet the needs of their MCH populations during COVID. We will have a partner fact sheet, if you will, coming out in the next couple of weeks, focused specifically on Medicaid policy options for the SHIN population. And that, like I said, will be available within the next couple of weeks, and we'll also feature it on next month's call. Okay, and then finally, I would like to invite you to join me and my colleague, Allison Northrup, on our government relations team on April 20th, a couple of weeks from now, to talk about opportunities to advance MCH with the new administration and Congress. You've already heard a lot about the great work that our GR team is doing. We'll continue that conversation, and we'll also look at opportunities to advance MCH with the Affordable Care Act and Medicaid during this new phase that we find ourselves in with the new administration and Congress. So please join us, bring your questions, and we look forward to seeing you. And now I'm going to pass it back to Amy.
Thanks so much, Stacey. And I'm going to hand it right back over to Dr. Suzanne Gilboa from the National Center on Birth Defects and Developmental Disabilities for an update from CDC.
Thanks, Amy. It's good to be here. Thank you so much for having me. My name is Suzanne Gilboa, and I'm coming to you in my role as Acting Director of the Division of Birth Defects and Infant Disorders in the National Center on Birth Defects and Developmental Disabilities. Typically, Karen Renley, our Center Director, joins for these town hall meetings, but I am in her stead this month. Prior to taking on this role as Acting Division Director, I did spend most of the last year in the CDC COVID-19 response, primarily working on on pregnancy surveillance for COVID and the expansion of our SetNet system that Amy just talked about. So it was really great to have that shout out a couple minutes ago. Thanks, Amy. I have 3 buckets of updates that I'm going to go through rather quickly. First are just some web updates on our pregnancy surveillance work. Second are some updates around COVID vaccination in pregnancy. And third, a brief update around increased funding to promote vaccination among people with disabilities. First, we have several updated and new pages on our website. And I think Wendy is about to put all of that in the chat, all the links. So briefly, we updated our pregnant people sort of homepage, our breastfeeding and caring for newborns page, and a toolkit for pregnant people and new parents, which is sort of a one-stop shop for lots of different resources. We have new and updated pages on COVID-19 vaccination and pregnancy. And then finally, just the other day, our SetNet data went live on the COVID data tracker, which is sort of the main portal for public data from CDC on COVID. And our SetNet data had not yet been incorporated into those into that portal, but now it is. So we're very excited about that. My second set of updates is around COVID-19 vaccination during pregnancy. We have heard some anecdotal reports of vaccination clinics denying access to pregnant women for vaccine because they don't have a note from their provider. And for that reason, we did want to review the CDC recommendations around vaccination during pregnancy. And the recommendation is that a pregnant person may choose to receive a COVID-19 vaccination. And if facing decision about whether to receive the vaccine while pregnant, consider the risks of exposure, the risks of severe infection, the known benefits of vaccination, and a discussion with the healthcare provider can help someone make an informed decision, but it's not required prior to vaccination. We do get several commonly asked questions that I wanted to quickly review. First, around fertility. There really is no evidence that any vaccine, including COVID-19 vaccine, causes any fertility problems. And all of these are FAQs also on our website. The question of immune protection for newborns after maternal immunization. Some recent data do show that people who have received COVID-19 mRNA vaccines during pregnancy have passed antibodies onto their fetuses, which could help them after birth. We do need more data on this to understand the level of antibodies and the level of protection, but the preliminary data are positive around this. Effects of vaccine side effects on the fetus. Side effects can occur when getting a COVID-19 vaccination in pregnant women, just like other people who are not pregnant. These side effects are generally short-lived, and we do not expect there to be an effect on the fetus. Fever has been a common side effect. However, acetaminophen can be taken by pregnant people who are experiencing fever or other post-vaccination symptoms. Information on the optimal timing of vaccination during pregnancy. Information is really limited about the effects of COVID-19 at different times during pregnancy. The maternal benefits of vaccination are expected regardless of the timing of vaccination during pregnancy. And we are really collecting a fair amount of data on vaccination throughout all trimesters of pregnancy, and we'll be reporting on it as it comes available. And then finally, reluctance to get a second dose after people find out they are pregnant. The early safety data are quite reassuring, and data from the clinical trials indicate that the COVID-19 mRNA vaccines are most effective after 2 doses, and therefore completion of the vaccination series with the second dose is really the most effective way to be fully protected. And then finally, information on new funding for people with disabilities. Earlier this week, there was an HHS announcement made around expanding access to COVID-19 vaccine for older adults and people with disabilities, with nearly $100 million in grants to aging and disability networks in every state and territory. These funds will help provide critical services to overcome barriers that are preventing millions of these people at risk for serious illness and death from COVID-19 from receiving vaccines. The partnership will also provide an additional $5 million for funding in national hotlines to assist older adults and people with disabilities in registering for vaccination, and to connect them with local disability and aging agencies that can help provide services and supports when necessary to help them. And then the additional funding will be distributed in the following way. To state units on aging and area agencies on aging, they will get $50 million. Aging and disability resource centers are getting $26 million. Centers for independent living are getting $5 million. University centers of excellence in developmental disabilities are getting $4 million. Protection and advocacy systems, $4 million. And state councils on developmental disabilities, $4 million. And that's all I have. Thank you.
Wonderful, thank you. And Wendy, thank you for making sure to link all of those new resources in the chat box. So without further ado, I'm going to turn it over to our guest presenter, Cornell Wright from the Department of Health and Human Services in North Carolina's Office of Minority Health and Health Disparities. And he's going to talk to us about an effort they set up during COVID to address the needs of historically marginalized populations. But I'll let him explain it. So Cornell, are you here?
I am. Can you hear me?
We can. Feel free to turn your camera on. It's up to you.
Oh, no, you don't want to see me today.
All right.
But thank you. Again, Cornell Wright, Office of Minority Health here in North Carolina. And first off, let me just say happy National Minority Health Month. Today is the start of National Minority Health Month, and the theme this year, as you may already know, is Vaccine Ready. So just wanted to give you just a quick snapshot of what we're doing here in North Carolina. With the start of COVID, we noticed that there was a need to really ensure that minority, underserved, and historically marginalized populations got connected to the right resources, PPE, education materials, and funding opportunities that not always were available before COVID. And so we made a very intentional effort to stand up what we call the Historically Marginalized Population Work Group. And that work group consists of 6 work streams: contact tracing and case investigation, wraparound services, which include isolation and quarantine supports, behavioral health, and then procurement, which we just renamed economic opportunity and equity. And the reason why these 6 work streams are so important is because it really focused on what we call historically marginalized populations, which oftentimes go beyond just race and ethnicity, but also identity groups, LGBTQ+, homeless, veterans, migrant, immigrant, disabled communities, you name it, tribal communities. You know, we are making sure that people who don't always have a seat at the table got a seat at the table. And the work has evolved so much from where we started last year to where we are now. And just a quick, snapshot into that work. We have people from state government and beyond working together. So you have people in the private sector, in the public sector. We have local health department personnel, including health directors, academic partners, hospital and health system partners, community-based organizational partners, faith-based organizational partners, grassroots organizational partners. You name it, we're connected to it. And this is a new way, especially in state government, to have such an amazing connection that's this consistent. I was just on a call before this one, and my boss, Deputy Secretary Ben Money, was mentioning to a group that we were on a call with that we've been meeting as a larger group every Tuesday at 12 o'clock since probably April of last year. And that's amazing because, there have been some transitions, some movement, but consistently there have been this core group of people who have met to not only work through, areas of issue that we see connected to COVID, but also some other social determinants of health problems and barriers that people are facing, in COVID and even beyond COVID. So this group has been meeting and doing some great work, serving in somewhat of a capacity role to leadership, making decisions here in North Carolina, so that we are making sure the voices of people are heard, and especially those that are hurting the most. We saw so many issues, as many other states can attest to, with our Black and Brown communities testing positive for COVID and dying from COVID. And so we had to address what we were seeing. In North Carolina, the African-American community makes up about 22% of the total population. And if you're looking at ethnicity, the Latinx community makes up about 10% of North Carolina's population. But when we saw the numbers for COVID, in terms of positivity rates and death rates, these communities were suffering the most by percentage, and we had to, do something to stop that. So the work that has been going on in North Carolina has really been critical to solving for that. And as we got vaccines in, we saw issues of people getting vaccinated, but it wasn't necessarily the most equitable process available initially. There's a lot of emphasis on the past federal administration to move with speed, but that didn't incorporate equity as much. So our leadership and Dr. Mandy Cohen, who serves as secretary for the Department of Health and Human Services, made sure that we started focusing on equity. So getting shots in arms, but making sure they're getting to the most vulnerable in our population, and also making sure the people in communities could get it in their communities. We've seen a lot of people going into communities that it may not be their own to get vaccinated. And so it kind of put people of that community at a disadvantage. So we also put in guidance, equity guidance and measures to make sure that the process became more equitable. So the state also does what we call equity bumps in certain communities to make sure, looking at the community and seeing the number of historically marginalized populations that in these communities, like who identifies as what we call an HMP, and then how can we get those people connected to the vaccine. And so we've been doing outreach and other initiatives to make sure that this has been going on. So with the equity bumps, we take the allocation that is given from the federal government, disperse it out through the communities, and then the communities that have a greater need, we are able to put an extra boost of vaccines when available in those communities and distribute it in the actual heart of community that we're seeing the most in dire need for citizens to be vaccinated. And so just recently, as things are opening up, we've announced here in North Carolina a new public-private partnership called Healthier Together Health Equity Network, Action Network. And with this Healthier Together initiative, the state of North Carolina, Department of Health and Human Services is working with a grassroots organization called NC Counts, who did a lot of work in North Carolina with mobilizing people with the census in 2020 to get out and take the census. And so now we're shifting efforts with this partnership to connect with NC Counts to get community-based organizations to help us penetrate communities in a more efficient way, and providing some funding to those community-based organizations to partner with providers across the state of North Carolina to make sure that people can have access to vaccine. I was listening to an interview this morning with LL Cool J, DJ Jazzy Jeff, and Dr. Fauci, and I forget the other young lady who was a doctor that was with Dr. Fauci. I think her name was Dr. Nunez. And Dr. Fauci's made a great point of saying, you know, hesitancy is not the issue, but access is. And that's something that has rung true in many states, but especially in North Carolina, of just making sure we have enough supply to meet the demand. And this new Healthier Together initiative does exactly that. So as we anticipate more vaccine supply, we're setting up these health equity action networks across the state using the Medicaid regions to make sure that they are aligned in the 6 regions across the state to have leadership in place to help coordinate these vaccine events and you know, the vaccine equity efforts that we're seeing here in North Carolina. So I'll stop there because I don't know if there's any questions, but we're really excited about what's going on here in North Carolina, and happy to share this information with you and see if anybody wants to do it in their state. We can help provide a blueprint if necessary, or just give some advice on and share some lessons learned as we start going through this process. So thank you so much for having me. And if there's any questions, I'll take them now, or if you need to put them in the chat, I'll look at them there.
Awesome. Thank you so very much. I don't know if you have any links to any of the work that you've been doing, but if you want to share those, feel free to drop those in the chat as well. And we can make sure that others learn more about what you've been doing in North Carolina.
Will do. Thank you.
Thank you. So we do have a question from Allison, and can you provide a little more detail about what comes under economic opportunities? I wasn't quite sure what falls under this line of action.
So glad, and I normally when I say it, I usually talk about it a little bit more. So I'm glad somebody asked that question, because I feel like I have failed you by not telling you everything that I normally say. But so for economic opportunity and equity, this is the work stream that we previously called procurement. And so in our procurement work stream, what we were seeing is that we did not have enough diversity, equity, inclusion into who we fund or how we fund organizations. And so part of the problem is for-profit organizations, there are these historically underutilized businesses designation that comes with this wealth of continuing education and knowledge. And for the nonprofits, there's nothing really that exists to give people that kind of information. So as you know, as CARES Act dollars came down, we were able to fund some organizations across the state. In my office, in the Office of Minority Health and Health Disparities, we were able to fund some Latinx organizations across the state, and then some African-American facing organizations across the state using CARES Act funds. So there's another layer of reporting than what we normally see on the state level that was required for passing out federal funds or granting federal funds or contracting with federal funds. And so getting those organizations up to speed on the new requirement that they maybe have never done before, or there may have been changes, that's another thing that had to be considered. So as we're doing this work in the work stream, making sure that people have access to, the RFP announcements and the different changes that may be required in reporting. Some organizations, we even had to help, with their SAMs and DUNS number, to make sure that all that information was correct. So what we are currently doing is putting together some guidance and information and resources to help broaden the scope and capacity of organizations in the community that do good work, but they just need that extra push, nudge, and opportunity to get funded. As we're seeing, there's so many people who get funded or organizations that get funded, and maybe the same players over and over again. So even considering putting in a mentorship program for larger funders to help maybe smaller organizations understand, the processes of getting funded. So I'm so glad that the question was asked, because the procurement space is such a pivotal point to bring up and make sure that we're seeing equity in the way that we fund organizations, especially that do community work.
Well, a comment from Allison is saying that this is fantastic, and I wholeheartedly agree with your observations and love the actions you are all taking to address this, which perfectly sums up what I was just about to say as well. I'm so interested to hear more about this. It's something that, I think we've talked about internally at AMCHP, even with our own procurement processes. And I know a lot of states are also thinking about this as well. And we talk a lot about alleviating that burden for smaller community-based organizations, especially for what it takes to apply for and then report on federally granted funds. So again, if there is more information you'd like to share on that, I think it sounds like a lot of people would be interested in hearing it. Allison also put into the chat her email. So thank you. I'm going to move on and let my colleague Laura tell you about an event that we have coming up, but please do continue typing questions in the chat and we'll use whatever remaining time we have to answer those.
Great, thank you so much, Amy. Can folks hear me? Great. So I want to share some information about an upcoming webinar that AMCHP's Global Health Work Group is putting on called Earning Trust, Building Vaccine Confidence, Lessons from Global and Local Initiatives. This conversation is going to be really focusing on what were the bright spots from COVID vaccine confidence building efforts, specifically in building trust with communities of color and tribal nations. And what can we take forward beyond the pandemic? So coming back to what Michael Worm was speaking about, thinking about vaccinations moving forward, what are the different things that we can learn? So our speakers are going to be Dr. Bruce Gellin from the Sabin Vaccine Institute. He's going to be offering a global perspective on lessons learned from global efforts. Sort of what does a global equitable vaccine distribution look like, and where are we currently now towards those efforts, and where do we need to move moving forward? Cecilia Thomas from Trust for America's Health is going to be talking about the history of vaccine hesitancy in the US and its roots in medical exploitation of communities of color, and also providing recommendations for state MCH professionals based on TFA's recent report on trust building. And then Dr. Ann Zink, the Chief Medical Officer from the state of Alaska, is going to be sharing lessons learned and insights from Alaska's incredibly successful vaccine campaigns, and talking about how they're already applying lessons that they're learning from their efforts for future vaccination efforts. So this event is going to be on April 16th from 12 to 1:15 p.m. I'm chatting in the registration now, and please feel free to share this with your networks, and we really hope that you can all attend this event. Thank you.
Great, I'm really excited about it as well. Thank you, Laura. Do we have any other questions? We have like 5 minutes left, so happy to take any questions from our participants today for any of the panelists. I know it's been a packed agenda, as these tend to be. Give folks another minute or two. And we hope you'll save the date for our next call, which will be May 6th from 2 to 3. The same link you used to register for today would have given you an option to register for the next few events as well, but in case not, we have it right here, and we hope you will join us then. We're always happy to take recommendations as well for topics you'd like to see it covered. We are also planning to have guest speakers next month to talk a little bit about some mental health and substance use trends that we're seeing during COVID. I think that continues to be a really timely discussion to continue having. And if there are no other questions, we will.
This is
Okay.
Becky from Louisiana.
Oh,
I
yeah,
put it
Becky,
in
go
the chat, but nobody saw it.
Oh, sorry.
Dr. Warren shared a webinar about childhood immunizations and the call to action. Was that a recorded webinar, or is that something that's happening soon? Because the link that we had went straight to a recording of a webinar, the link that was put in the chat box.
Is there anyone from MCHB who can answer that question?
Amy, this is Wendy Rubin from CDC. I can try to answer. It's for a webinar. It's scheduled for April 7th from 2 to 3 p.m. Eastern. I'm sorry that link didn't work. It should have been the registration link for it. Oh wait, no, I'm sorry. It says no registration is necessary. Use the link on April 7th from 2 to 3 p.m. and it will be live at that point.
Is there any sort of website or page that we could share? I'm trying to share it with our providers network on social media, and that's where I got stuck, because that link isn't really promoting it or saying anything about it whatsoever. It's just a beautiful, colorful picture and a login.
It is not a great link. I have an email I could forward. There's not a web page, but I do have like an invitation style email I can share. Amy, do you want me to share it with you? And you can.
I was going to say, if you send it to Jess, she'll add it along to the slides that go out to everybody after the call. That would be great.
Awesome. Thank you so much.
Thanks for flagging that, Becky. Any other questions? Sorry, we didn't see there. I'm going to just check, make sure there's no raised hands. All right. Then stay safe, everyone, and power through if you're another parent going through spring break this week. And we will see you all next month. Thanks.